Hello everyone, in this video we are going to take a look at the processes of the maxilla, that is frontal process, zygomatic process, alveolar process, palatine process. First, the zygomatic process. This large irregular zygomatic process forms the apex of the pyramidal body of the maxilla, and it articulates with the maxillary process of the zygomatic bone. And from this zygomatic process you have a strong buttress of bone extending down up to the first molar, which helps in transmitting the forces of mastication. Now we look at the frontal process of the maxilla. This is the lateral view of the frontal process. Anteriorly it articulates with the nasal bone. Above this jagged apex articulates with the nasal notch, the frontal bone. Posteriorly it articulates with the lacrimal bone. On this lateral surface you can make out the extension of the medial margin of the orbit. This also functions as an anterior lacrimal crest, and there is this half of a groove behind this crest which is completed by the lacrimal bone, on which you have the posterior lacrimal crest. Together they will complete the groove, the entire lacrimal groove, which will lodge the lacrimal sac. And again on this anterior portion of the frontal process, on its lateral surface you have the attachment of the orbicularis oculi and the medial palpebral ligament. Now from the zygomatic and the frontal process, if we move to the alveolar process, on the alveolar process you can see the sockets of the permanent teeth, 8 sockets for one half of the upper jaw, and you can make out that over the canine tooth there is quite a prominent elevation over here. This is called the Canine Eminence, outside of which you have the canine fossa, and medial to which you have the incisor fossa. So incisor fossa, Canine Eminence, canine fossa, part of the alveolar arch which bears the socket for the teeth, and just outside the attachment of the 3 molar teeth you have the attachment of the buccinator muscle. So this is the area for the buccinator muscle, and over here you have the attachment on the adjacent part of the body of the depressor septi. So much for the alveolar process. Now if we take a look at the medial surface, we have completed zygomatic process, frontal process and alveolar process from the lateral view. If we take the medial view, then we shall be able to see the medial surface of the frontal process and the medial surface of the alveolar process and the whole of the palatine process. But before that, let us take a look over here. And again you can see in this schematic the attachment of the buccinator muscle. You can see the canine eminence and you can see the depressor septi. And over the frontal process you can see the attachment of the orbicularis oculi and the medial palpebral ligament and another muscle, the levator labii superioris alic nasi. And you can see the half of the lacrimal groove and the anterior lacrimal crest. Now let us go to the medial surface. Here on the medial surface again you can see the medial view of the frontal process, and here you can make out that you have 2 transverse ridges over here, one over here, one is over here. This is the ethmoidal crest and this is the conchal crest. This is the lateral wall of the nose actually. So this portion belongs to the inferior meatus, this portion belongs to the middle meatus, and this portion to the superior meatus. So over here you have the ethmoidal crest where you have the middle nasal conchal attachment, and here you have the conchal crest where you have the attachment of the inferior nasal concha, and here is the middle meatus, and from this ethmoidal crest you have a fold of mucous membrane, the agar nasi, going down into the towards the anterior nasal opening, the anterior nares, and over here you have the atrium of the middle meatus. So on this side again you can see the details of the alveolar process as well. and you can see the alveolar process bearing the teeth. And not only that, on the medial surface, for the first time you can see properly the palatine process. So you can see this is the palatine process forming the major part of the hard palate. A smaller part posteriorly, about the posterior 1/4, is formed by the horizontal process of the horizontal plate of the palatine bone. Now this palatine process of the two maxillae, they unite in the middle to form a palatine crest, which is further raised anteriorly to form an incisor crest, and here you have the anterior nasal spine where it ends, and just behind the incisor teeth you have this gap, this small tunnel. This is called the incisive fossa and the incisive canal. Now through this incisive fossa and canal pass the greater palatine vessels from below and the sphenopalatine vessels and nerves from above. So sphenopalatine from above, greater palatine from below through the incisive canal. Now here you actually have usually two canals side by side for the right and left set of vessels and nerves. Occasionally you can have the two canals one behind the other. If you have them one behind the other, then in that case the left set of vessels and nerves will pass through the anterior one and the right set of vessels and nerves will pass through the posterior one. So in the palatine process you have incisive fossa and canal, and this palatine process is forming the hard palate with the crest or the palatine crest over here in the midline. This is slightly elevated. And if we look at another schematic, here you can see the palatine crest again, and you can see the incisive fossa with the incisive canal, and you can see the alveolar processes over here. Another thing is that on the body over here posteriorly, where you have the attachment of the perpendicular plate of the palatine bone, you have a small gap which is created for the passage of the greater palatine vessels and nerves, this greater palatine groove. You can't make it out over here because you have the perpendicular plate of the palatine bone plastered to it. But here when it is separate, here you can make out the greater palatine groove, from which again you have lesser palatine vessels coming out and nerves coming out. So again on the medial view you can see much of the frontal process, the alveolar process, and almost the entire palatine process. Now if we take a look at this picture, here again you can see the palatine process and you can see the incisive fossa and canal, and again you can make out here the lacrimal bone and the ethmoid bone and the inferior nasal concha. So alveolar process, palatine process, and frontal process. Now if we look at this picture of the base of the skull, this is the best way to display the palatine process of the maxilla. You can see the palatine processes of the two maxillae forming the anterior 3/4 of the hard palate and the alveolar arch bearing the teeth of the upper jaw, and you can make out here the posterior part of the hard palate formed by the horizontal process of the palatine bones. And here behind the first four incisor teeth you can make out the incisive canal and the foramen leading to the incisive canal. From here actually you might have a small groove or suture passing and isolating these four incisor teeth. Developmentally this segment is also called the premaxilla. So over here you have the intermaxillary suture, and over here you have the palatomaxillary suture, and you have these ridges formed by the attachment of the mucoperiosteum. The mucoperiosteum is attached to the alveolar arch for the gums, and the mucoperiosteum is attached to this under surface of the palatine bones, forming the stiff soft tissues of the hard palate. And behind over here you can see the openings for the greater palatine vessels, which are actually within the palatine bone. So I think we have covered all the processes of the maxilla now. So we have covered zygomatic process, frontal process, alveolar process, and palatine processes. So that ends here. Thank you.